come back to it, there are specific areas that might be of interest to you. And so the table of contents will have a link to those different sections just for quick navigation or understanding where that information would be. And so that could be things like accessing the form, populating the form, attaching the line lists that are utilized through it, and then actually completing your submission. And this just kind of indicates the different pages that information is laid out on. And so initially, the first thing you're going to need to do, obviously, would be to access this form. And so within this user guide, we do have that link here. And so you would just need to take this, copy, and paste it into your browser. Just one call out for utilizing this form. It's not quite ready. You would be able to start submissions, I believe, as early as Monday next week. So just keep that in mind as we're progressing through this. You would be able to start doing this early next week. Once you've accessed the form, though, you're going to go in and you can fill out any necessary fields. And just a call out here, there's going to be required fields, and those are indicated by a red asterisk. And so whenever you see that, that is going to be a required field, and you can't complete the submission without filling out those different fields. And so there's 3 sections in the form, if you want to think of it like that. The different pieces of information, the fields as I call it, are grouped into those sections, and they're going to be the submitter information. And so that's the individual, yourself, who is providing this information, and potentially a secondary contact. After that comes establishment information. And so what's the business, that establishment, where is it, what's it called, different details related to that. And then lastly comes the incident summary, and that's where all the details for the cases, the contacts, and the disease type specific information would go there. And so right here, this is just going to give you some information related to the request form for the submitter information. And so again, just to call out, the asterisk does indicate a required field. And so you'll enter out in the personal information like the name, the address, phone number, email, things like that. In the scenario in which there is an additional point of contact that we would like to have or reach out to, there is a field for that indicated with the number 2 here. There's just a simple yes, no type of question there. And in the case that you need it, you respond yes, and it'll allow you to enter the other information. And just so we are all aware, I will go through all these forms and we'll populate it together. I just want to explain the guide here quickly. After that will come the establishment information. And so again, that is the business. And so we're going to need to understand the type of establishment. And for today, we're going to be going through it with the schools. K through 12 will be what we're going to use today. If you have an establishment type of a school, there is a school type that we can then further understand: public, private, or charter school. And then we'll simply enter in the establishment details, including that address. After that, we'll come into the incident summary. And so there is a submission form that we use. And so right here is a few pieces of information related to that. And so there's a field, as you can see, with the arrows pointing to it, to indicate that there is a template that's going to be uploaded. And so when that's selected, it'll display what you can see beneath that. So there's the file uploader, there's some guidance text, and then there is a submission template that can be downloaded and utilized for yourself. And so you'll simply need to check the checkbox, go down to the template if you don't have it, and capture that, open it up and populate it with any data that you need to submit, and then save it as a CSV. And so to do that, there is a little bit of instruction here just to make sure that you understand that when you have finished updating that line list, it does have to be saved as a CSV file. I will show you how to do that today, just in case you're not aware, but it is very simple. It's just taking it, save as, changing it to a CSV. And then once you have it saved in the proper format, it can then be found and added to the submission in the file uploader. After that's done, you should see some sort of success notification like this. And so you can see in the number 5 box to the bottom left, that's what you'd see once you add a file. The green check mark shows you it's done. Once it's done, it'll show up as you see in the number 6 on the middle of the page here. It'll show you the name of the file, the type, and then the little trash cans, how you can remove it if you need to do that. Other than that, you're going to have some basic information for the incident. And so is it COVID related? What is a suspected disease? There's lots of values in this field, but it is, again, it's just the suspected disease. So just tell us what you suspect it to be. After that, there's the estimated number of visitors or patrons, the number of employees, a basic description of this incident, and then the positive case submissions. Once you submit that, you'll get a success message that'll tell you, just like this on this screen, And if you need any help, just again, in this PDF here or the presentation I'm showing, we have the contact you can reach out to. And so that's just a quick overview of the content in this guide. And now I can actually transition to showing you a live demonstration of what you can expect when progressing through this. So just give me 1 second to move that out of my way. And just want to ask, is this little box right here showing for you all? And do I need to move it? Is this going to be blocking your view? I just want to make sure you can see everything on my page.
Can you make the screen larger? It's really hard to see.
Yeah, absolutely. Does that look better?
Yes, thanks.
All right, great. And so again, if you were looking at the slides, this is going to be the same pictures, or the pictures were taken from this submission form here. And so this is going to be at the top of that form. It starts out with some submitter information. And so when you come to this form, it's just going to start out with that. And so first name is going to be first. I can go ahead and enter my first name, the last name. And so this is, again, a required field. You can understand that by seeing the red asterisk. And if you hover over it, it'll actually tell you what it means, as it's a required field. Underneath that, the date of birth, the title. And so this is your title. You can write in whatever that happens to be. And it's just a text field, so you can write it out simply. Underneath that is going to be a phone number. In other scenarios, we have unknown phone numbers. In this one, I think we should have a sufficient understanding of phone numbers, so just type it out. You don't have to necessarily put it in any special formatting. You can type it out with the numbers like this. But if you would like to have it formatted, you're more than welcome to format these numbers like a phone number. When entering it, it'll accept either way. Underneath that, if you do have an additional phone number, you can enter that in here. Then comes your email. I would advise not using a test email. For the additional point of contact, and so this is where there is a secondary point of contact that may need to be contacted or reached out to related to this submission. And so if there is that additional point of contact that we'd like to know, that's going to have the question here. Again, it's just a simple yes or no. If you respond to yes, you can see that there is some additional fields that are shown. And so if there is no additional point of contact, no reason to fill out these fields. But in the scenario that there is, then we can actually capture that information. And so we will have the first name, again, for this person, the last name for them, their title, the phone number for this individual. If they happen to have an additional phone number that we'd like to use, you can add it there. And then again, the last one is going to be for their email. And that will complete the information related to the person who is submitting this information in the submitter information section here. After you finish fulfilling this information, adding your information or potentially the additional point of contact's information, after that will come the establishment's information. And so you can see here, establishment information, with the first question being the actual establishment type. And so for today's purposes, we are going to utilize one of the school establishment types. And so I'm just going to simply find it in here. The one I'm looking for is going to be schools, K through 12, but we can see there are other types of schools that are available. After I select that, the next field, based on it being a school, is going to be the type of school that we're talking about here. And so for today's purposes, I will use public, but there are other options for a private school or a charter school as well. After that will come the establishment's name. And so for today's scenario, we're saying it's a school. And so we'll just want to write out the school's name, the address that's related to this school. If there is an apartment or suite, since this is a school, it's likely not going to be an apartment or suite number, but in other scenarios, we have other types of businesses. And so that would be more relevant for those scenarios. After that, we have the city. There's a state here. And so within this pick list, there is all the different states. And if you're looking for a specific one, you'll come into here and you can find it. Let me find DC, the postal code, and then the country. This will just be defaulted to United States, but if for some reason it needs to be changed, you can do that. And that will be all of the information related to this establishment, including the type, if it's a school, the type of school specifically, the name, and the address information for this establishment. Once that is finished, you will come to the third section of the form, which is that incident summary. And so again, there is this checkbox here related to that line list. And so I have a line list or need a template to upload. And so when you check this box, it will show this information here, including the template, which is at the bottom here, line template for submission available below. This is a clickable file here. As I click it, you can see in the bottom left corner, it's downloading that template. And so once you get that, you can take it and actually update it with the information you need and then place it into here. And so for today, I have taken that same file and pre-populated it with some information so we can track through it together. And that's what I'm going to share now. I'll zoom in just a little bit. Oh, I keep clicking the wrong one. There we go. Get it zoomed in a bit. Let me know if I need to zoom in a little bit more, and I'm happy to do so. And so this is the line template. You may or may not have ever provided a submission in the past. And so we can talk about the different pieces of information that are related in here. And so the first things that you might be interested in filling out is going to be, whom is this related to? And so we have a field for a first name, a last name. Just simply type out the respective names into each. Mark Thomas is going to be our first. After that comes a field for, is this a contact or a case? And so we can see that there are two options if I click into this. First one is it's a case, and the second one is it's a contact. And so presumably when filling this out, you're going to start out with that case, and then you'll produce the contacts related to that case after it. And so right here, first selection for Mark Thomas, I have entered it as a case. You'll notice that there is a bit of guidance text in some of these headers for you. And so in the red text we can see right here and in other areas, it says if a contact. And so specifically, if the information is related to the contact, not the case, then we want to add in this information. And so what is this information? The first field is going to be whom is this related to as far as the case that this contact's for. And so just simply take that person's first and last name and add it in here so we can understand that there is a relationship between these two. After that, what is the last date of exposure for this contact in relation to the case that they have had an interaction or contact with? And so simply enter in the date here for that last date of exposure. After that, are they aware that they are a contact? And so there might be scenarios that they do know or don't know for sure. And then lastly, they may not know in general. And so there is also an option for unknown, but the best information to get would be a yes or no if we happen to know that information. After that is going to come the symptoms. Do they have any symptoms? Yes or no. They should know if they have symptoms. And so we just like to understand if they are currently or experiencing these symptoms. After that, if had symptoms, and so it's only going to be relevant information when you see an answer or a response as a yes here. And so when there is no symptoms, you don't have to provide dates for symptoms, obviously. But in the scenarios that we do have those symptoms, we would like to understand the date of the symptom onset date. So what's the first date that they noticed those symptoms? After that, what is the date of test? And so there's a test collection based on these symptoms. When was that actual test collected? What was the last date that this individual was at the facility that's reporting this? And then what was the actual date that the facility was notified? And so when there are symptoms, there's going to be specific information related to that. If it is a contact, then there's going to be specific information related to those individuals. And then as we can see here, again, if it is a case, then there's going to be required fields to understand the information related to the case that is stemming this from. After you get the required fields related to the facility, the date, and the notifications, the next field is going to be a date of birth. And so this is just simply that actual date of birth for the individual. Just type it out and provide that information there. Next field will be the race. And so this is another field where we have selections for you. And so when you come to this field, just simply click into it. You can click the little arrow drop down and then select whatever race it is that we'd like to identify for this person. And so the current options are Black African American, Asian American Indian or an Alaskan Native, Native Hawaiian Pacific Islander, white, other or multiracial, or unknown. After that will come the ethnicity field. And so this one just has a few options for us just to understand if this person of Hispanic or Latino descent, or in the case that we do not know, there is also an option for unknown there as well. After that comes a phone number. And so just to call this one out, you don't actually have to type it out in a phone number format. I'll show you how it works. You can just type out the numbers. It will format it for you, so don't worry about that. Just simply type out the numbers for us and we can capture that information. This is going to just be that 10-digit phone number. There might be a scenario where there's a proxy. And so the proxy, if this person is under the age of 18, we would like to understand the name of that proxy and then also the relationship to this individual. And so right here is just one example where we're saying that this person has a proxy because they're under the age of 18. The individual's name is seen here, and then the actual relationship to the person is this is their father. And so after that, we can capture this person's phone number in case we need to reach out to them and understand some more information. And so this would be the proxy's phone number as opposed to the actual individual's phone number seen here. After that is going to come some more address information. And so street number, name, quadrant, if they are not a DC resident. And so just pay attention to these fields as these are only important if this individual is actually not a DC resident. And so we'll have the street name information here, and then we'll also have the city so we can see where that they're currently residing, and then the state. And so right here we can see the state has another drop-down list. And so this has all the different states that are available, the same as you might see in the consult submission form that I showed earlier, and you'll just simply need to identify whatever state it is. After that is going to come this person's role, job title. And so that could be, it's not necessarily a title, it's more of what they are. And so we can see that there's some different options for here. And so there's just some examples given. This isn't all inclusive. This is not a selection box, as in you can only select from it. It is a text field. And so if there's a different title, you can obviously add that. But some examples are given here, as in a student, a staff at a school, or a visitor of an establishment. And so those are just 3 example types. You could add in whatever is the most important information for the titles there. After that, want to understand, is this a childcare or school attendee? And so just 2 options or 3 options here, I'm sorry. There's childcare, school, or neither. And so just identify what the correct answer or response is for that related to the contact or case. The student type. And so if this is a student, then we would like to understand the type of student they are. And so we can see here, we have some students, we have some visitors and staff. And so obviously you don't have the student type. If it's a staff, you would only need that if they are an actual student. And so there are several values in here for the different types of students that we have in different types of schools. And so we can see some examples. Childcare, daycare, preschool, elementary, middle, high, and then even through college and postdoc. So just simply identify whatever student type they are if we're saying that this is a student, so we can have a bit more understanding. And then additionally, is this a child care center? Then we want to understand the name of that center. So just simply type it out here for us so we can see what the full name is, including the campus, if it's known. The child care center for the school university's address. And so this is that name for the campus, and then this will be the address for it. And for other facilities, there are non-child care, non-school facilities. So, all right, I think that sound has subsided, so I'll continue. All right, so for all other facilities, as in not a school, not a child care facility, you can add in the name of that facility here. And so for today, we've added in just a name of a facility for Eat Burgers here. And so this is a non-healthcare facility, a non-school facility, I mean. And then for other facilities, again, not the child care or schools, we're just going to have that street address and then the city and state as well, and the zip code. After that, there's a question related to this individual living in a congregate residence. And so that could be a shelter, DOC, DY, there's a couple acronyms in here, a group home. And so just want to understand if they do live in one of those congregate residences. And so there's 2 options here, one's for yes and one's for no. After that will come the description of the interactions. And so right here is a text field that we can enter into detail to understand what that interaction was. And so just simply type out including the person, the place, the date, time, and who they actually were interacting with. And so just some examples here just to show what we might expect to see or what you could potentially add. You can add in what they did. So they ate lunch with Mark at Eatbergs on 5/31 around 12 p.m. And that will let us know who did what and where the time frame in which it happened. So we can see this is related to a food instance, and then there's another instances down here where someone was doing something on campuses. And so for each of the different interactions with the contacts, just want to understand what they were doing, when they were doing it, and where they were doing it. After that is going to come the vaccination status. And so there are a few values here for us. We want to understand if this person's up to date, if they happen to be incomplete, or they have a couple boosters, 1 or 2, they're not vaccinated, or if you don't know, again, there's an option for unknown as well. And then the last field in this file is going to be related to COVID. And so have they had COVID in the past 90 days? Real simple right here, just yes or no, so we can understand that. Once you have done this and entered in all of the information that is required for your submission and you're ready to take it and convert it to a CSV, you can just simply go to the file, save as. If you'd like to rename the file, you can obviously do that. Change the type. And so this secondary field here is going to be the type of file we're saving it as. And so just come into here and find the CSVs. So let's see. .csv is the one we're looking for. Just a second. All right. Once it's been converted, we should be able to find it here. And just so you know, it won't let you find a file that is not the correct type. And so if you did not convert that file to make it a CSV, as we can see here, submission 7/27/22, you won't be able to find it in the file uploader and you won't be able to finish your submission. And so just want to call that out for everybody so we're all aware. We can only see the CSV file. We don't see the Excel workbook. And so that is a very important step for you to do. Make sure you click that Save As. You can revise the name, it's up to you, but then change the file type to be a CSV file, and then you will be allowed to add it to the submission. And you can just find it in the file uploader by doing that, or you can try and drag and drop it from your file uploader. Nonetheless, we will see that the file has been uploaded here. The green check mark lets me know that I have successfully done it. Once I click done, I can then again see that this file right here has been added. It's the correct file type. And if I need to remove it for some reason, I can do that as well. Once that's finished, there's a few other questions underneath that. And so the first one's going to be, again, is it COVID related? Just so we understand initially before reviewing all the different cases, contacts, and the more specific information, just in general, is it related to COVID? Again, what is that suspected disease? And so if I'm saying it's COVID, I should probably flag it as COVID, but if it's not, then you have the option to select a different disease in here. And so there are a large amount of values in this field. So just select the one that you're suspecting it for so we can understand the suspected disease that this is related to. And so for today, I'll leave it as COVID and we'll select that one. Estimated number of visitors or patrons exposed. Let me remind myself how many was in the file. We'll say about 15. Employees exposed, we'll put in 3. And then right here is where we can add out the description for this incident. And so this is a long area text field, so you can type in quite a bit of information here. So feel free to get into the details with us and add in as much supplemental information as you can. For today, I'm just going to write in test. Underneath that, you can just identify the positive case submissions that are going in here. And so in that file, I did have 5 cases. And so for today's submission, I'm going to have the same value here for 5. Once you've finished entering in all the different details related to the submitter, related to the establishment, adding or updating this file to add in the line lists, and then finishing out any supplemental information related to the submission, you can finally hit the submit button. And now we can see that I have successfully finished my submission. And so this is the page that you would expect to see after you finalize that submission. And so it just simply tells you thank you for your submission and gives you some guidance on when to expect your responses. After this is done, your submission is completed. And then if you have additional submissions, you can go back to that link, reaccess the form, and then add in another submission as needed. And so that will be the end of the Streamline demo. I think we can take any questions, or if there's potentially something you would like to see me go through again to help revisit it, I'm happy to do that as well.